Okay, I'll start the lecture. Just drop a message in your group to join. Okay. So today we'll be seeing the spatial test to be performed in the shoulder assessment. Okay. So we how we decide to what kind of spatial test we'll be doing on the basis of history, on the basis of how the injury has been happened. Okay.
Ma'am, sorry to interrupt, ma'am. Your screen is not visible.
I have shared. Should I try again?
Yeah, ma'am, please.
Okay. Now is it visible?
Yeah, ma'am, it's visible now. Thank you, ma'am.
Oh, okay. So today we'll be seeing the spatial test in shoulder joint. Okay. So what are the reasons or how you will know okay, what kind of spatial test you would be performing? Okay, it depends on the history. It depends on the type of injury. It depends on the posture that we have observed, any muscular thing you have observed. Majorly on the history part, you would be covering it. If someone is coming with a history that I had a fall on my shoulder, right shoulder, and I have a pain on the anterior side of my shoulder and my lateral. So you know okay, there might be a rotator cuff or AC joint is involved, or someone is coming with a history that I fell on my outstretched position. So what happened? There might be a dislocation posteriorly. So then we'll be seeing any instability in the shoulder. Then we will see what are the muscle involved. So for that particular muscle spatial tests are there. So those are things should be performing. But when someone say fell down on the outstretched position, okay, so there is a posterior dislocation. So it should come in your mind. Say I'll be performing the spatial test for posterior instability. Okay, then you do not have to go for the anterior instability or any apprehension test. Okay, then other would be if you see that someone has a pain of overhead abduction. Okay, when they are doing abduction, they are having pain in certain area. So you'll go for the particular muscular thing. You will see bicep. You will see rotator cuff tear is there or not. Particular muscle, supraspinatus, infraspinatus. Those are the things. Okay. Does everyone have that book now, Maggie? Okay. So I'll be covering few of the spatial tests and I'll be giving you some homework to do. Okay, some assignments to do, and I'll give you few conditions. Everyone has to bring out or just note down the spatial test they would be performing. So I'll be giving two or three cases. You all have to just bring what are the spatial tests you'll be doing and why you will be doing. In Maggie, you have more. I have just involved the important one. But in the cases, I'll be asking everything. So you just have to go through in the Maggie book that I have shared to you. You have to go through that and you have to select the spatial test and how you'll perform and what are the provocating or what are the results you're expecting in that spatial test and why did you choose that spatial test, you will tell me on depending the case. So first is anterior instability. When you feel that there is a chance that there would be instability of the shoulder because it's a chronic case, okay, and the muscles are very weak, wasting is there. So then you will also check the, now you're not aware, there is no history of injury, there is no history of fall. So will be checking both the anterior and posterior. So then you will just check the instability. So in this, what we are doing for the anterior instability, what we do, I'll just explain you. The patient is sitting, you'll be standing just next to that. Just imagine the patient is having right shoulder pain. So your hand would be like this. This is the placement of the hand. You'll be holding the humeral head, and your other hand, the left hand, would be on the arch of the shoulder, on the shoulder blade. And then you'll just hold the humerus, you'll distract it, thoda sa. You'll distract it, and you will do anterior movement. Okay, and then posterior movement, that is giving the load, means you will distract that shoulder down and then you will shift. So that's how the name is load and shift. for the instability. For the anterior instability, we'll move the humerus anteriorly. In the posterior instability, or to check the posterior instability, you will move backwards. Okay. Now in this, how can you say that this is shifted too much, or this much of shift can be called as instability? If I'm going to bring down that shoulder down and shift it, it will go to some mm forward and backward as well. So to what much extension of the movement, you will say it's the instability. Now that is given in Maggie. Particular amount, a particular point is given that you will search it down and tell me in the next lecture. Maybe probably I'll make sure that tomorrow we have a lecture because we didn't have on Thursday, we didn't have on Friday, okay, and even on Thursday we didn't have any lecture now. So I'll make sure that on Sunday we have, and we'll just cover this basic text. Okay, so this is clear. The position is clear. Any doubt till here? So just remember, or anyone just noted down the questions I'm asking for you all to do or bring on the Monday or on Sunday tomorrow, so that we can discuss about this in deep. The other is apprehension. So now just say कि you did this. You just did the load, you have given the load and you have shifted the shoulder, but you're not that sure. When someone says that they have pain, particularly in the anterior side, okay, then you did a, horizontal adduction you did. When you rule out that there is no involvement of AC joint, but you feel that that can be anterior instability. So particularly for the confirmation, load and shift is not the confirmative spatial test we perform for anterior instability. For that, we go for apprehension. In this, what we'll do, we'll ask the patient to lie down at the edge of the bed. The shoulder should be at the edge of the bed. You will just take 190 degree of abduction, 90 degree of flexion at the elbow level. Okay, and this is the position, starting position. Okay, you'll be holding the elbow, and then you'll just push it downwards to the ground. Okay, the examiner abducts the arm 90 degree, laterally rotate the patient's shoulder, but before that you have to bring the elbow also at 90 degree, and then you just laterally rotate it. So what will happen, the shoulder will pop up, the humeral head will come up a little bit. If they are having, there is a crying sound is there, or if they say yes, yes, the pain is increasing right now, so there would be a confirmative thing. Yes, there is an instability or there is a pain due to the anterior instability. Now, Rockwood test for anterior instability. In this, what we do, we check at different angles. The same thing we are doing, but we are not abducting at 90 degree, and the patient is in not in supine, but they are in sitting position. The position is sitting, but abduction at different angle. It would be like 30, 45, 90, 110, and 150, the extreme. And then while keeping the arm in just say 45 degree, then you will do lateral rotation. There is no pain. When you see in 90, there is a pain. When you see in 20, there is a pain. So then you just see what muscle is involved in that angle, and you'll work on that. For initial, there's a deltoid muscle working. For middle 60 degree, rotator cuffs are involved. So when there is a pain from 45 or like 60 degree or 90 degree or just above the 90 degree, so you'll rule out the rotator cuff muscles are also involved, as well as the instability is there because of that, because the muscles are not able to hold it down. So you'll be working on that. You'll be giving a bit of distraction if there is any impingement you feel. Okay, and you'll be mobilizing that. If there is an anterior instability, you'll be mobilizing posteriorly. For the posterior shoulder instability, as I said, it's a load and shift test that you'll be performing. This the same thing you're doing in this, but you're just shifting backwards. Now the test we perform for the inferior instability. So majorly for this, we are seeing the sign. So what happened in this, we will make the patient sit and we will just put their arm hanging. And if there's sometimes what happen, if there is too much of wasting in the muscles around the shoulder, you can see the sign, step down sign in those. That is also known as step down deformity. Okay. And sulcus sign. But if you cannot find that, what you will do, you'll hold the humerus and the at the arm level, at the distal end of the humerus, and you just pull it down. Okay. When you pull down and you feel that there is a sulcus formation, there is this kind of depth has been seen, that confirms that there is an inferior instability. Okay. Means the rotator cuffs are not holding it properly. Now, now you are ruled out. Just say you did not find anything in instability of shoulder, or you found something in let's say inferior instability. Now you want to see what are the muscles are involved in this, particular muscles involved in such things. So you'll go for the impingement. The first is knees impingement. In this, majorly these are the supras like rotator cuff muscles are involved in this. Some are basically for biceps, for some are for bicep tendonitis. So there are many special tests. In this, now we are going for impingement. So impingement is mainly when the muscles are not able to hold it, and there is some kind of rub is happening, or the tendon is being impinged with the movement, with the extreme movement or with the slight movement. So in knees impingement, what happens? The patient arm is passively. In this, what we do, you passively or forcefully elevates the patient's arm. So basically, you just have to ask the patient to stand, okay, and ask them not to do any active movement. You will hold his arm or the forearm and medially rotate it, and then you will passively take the arm and elevate the arm overhead. If they feel any pain in the anterior surface or on the uh, anterior bicep area, so that is a confirmative thing to say that it's an impingement test for the biceps and supraspinatus, or bicep tendon has been involved in it. Okay. The other is Hawkins Kennedy. In this, majorly supraspinatus tendon is been rubbed against coracoid process in this spatial test. Now, let's just say you need a confirmation that you feel that because of the injury or because of his or her overhead activity or typing thing, her trapezius muscle is being wasted. So you think the rotator cuffs are involved in that. So you just want to see, you do not want to see any instability. Okay. So you'll go for the muscles. So you'll see the supraspinatus muscle. So for that, you will make him do this Hawkins Kennedy impingement test. In this, what we do, the patient stands while the examiner forward flex the arm to the 90-degree, then forcefully medially rotate the shoulder. The movement pushed the supraspinatus tendon against the anterior surface of the coracoacromial ligament and coracoid process. The test may also be performed in different degree of forward flexion vertically circling the shoulder, and the pain indicates the positive test for supraspinatus, paratenotypus, tendinosis, and secondary impingement. Okay, so to rule out such things, supraspinatus, paratendonitis, and tendinosis, and secondary impingement, you perform this Hawkins Kennedy. And this is a very important spatial test in shoulder. Along with the stability, the particular muscular spatial tests are very important to rule out. In master's level, you do not have to go much in the what we say for the treatment protocol, because you have been studied that in PPT. But here you need to know the differential diagnosis. If someone come and ask you, why do you think, what are the structures are involved, you cannot normally say, yeah, I feel it's anti-instability, but you have to give some muscle You have to say, is there any labral test, any labral involvement is there? Labral lesions or the SLAP test. There is a 3 to 4 spatial tests to rule out the labral lesions. Okay, so be very careful when you go through such spatial tests. Try to perform when you even right now, if you have any shoulder patient, go and check certain this kind of spatial test on them. It will really help you for differential diagnosis. So as I said, labral lesions. For labral lesions, we have two two tests. First is Klunk test. In this, as everyone know, labral lesions happen more majorly happens in the anterior side. The only muscle that has been involved in it is bicep. Otherwise, the labral that circulates the humerus or the glenoid that has been rubbed against the tendon and it has been injured or tear is there or there is some kind of rubbing is there. So in Klunk test, what we do, the patient lies in supine. The examiner places one hand on the posterior aspect of the shoulder over the humeral head. The examiner, the other hand, holds the humerus above the elbow. The examiner fully abducts the arm over the patient head. The examiner then pushes anteriorly with the hand over the humeral head, while the other hand rotates the humerus into the lateral rotation. See, here what we are doing is we are just asking him to do the abduction, okay, the flexion and the abduction, and then you rotate it while you push your thumb above. You're just pushing it upwards and making that labral to get contact with the bone. Okay, that is the provocating test. The clunk or the grinding sound indicates a positive test and is indicative of the tear of the labrum. Anterior slide test is again for the labrum. You just make them put their hand on their waist, and the patient is sitting with the hands on the waist, thumb posterior. The examiner stand behind the patient and stabilize the scapula and clavicle with one hand. With the other hand, the examiner applies the anterosuperior force at the elbow. If the labrum is torn, slap lesion, the humeral head slides over the labrum with a pop of crank. So in this, what we are doing with this position, you will just hold the shoulder, and at the elbow level, you will just push the humerus into the glenoid cavity. Okay, if you feel any crank sound is there or there is an increasing pain, so it's a positive test. Is everything? Is this clear to everyone? Any doubt till here?
Madam, we need to read at home.
You need to read it first.
Hello?
You want to read it right now or at home, like on Sunday or something? Actually, do one thing, just go and read that Maggie book which I've given you. Okay, just go through it, go through the structures involved in shoulder, the labral, the muscles where they are. Just go through the normal anatomy. So when I'm talking about bicep, when I'm talking about labrum, when I'm talking about rotator cuff tendon getting impinged, the position of the arm would be clear for you all people. Okay, and then we'll just see the conditions in which condition you can do certain kind of spatial test is must required, and what are the muscles involved in chronic condition, what kind of muscles are involved. Those are the things we'll discuss. Then we'll take the scapular stability. It's a big thing. It's a the scapular muscle will be involved in those things, and it's a small topic. So, but till before that, just go through the structure, anatomical structure of the shoulder, go through the conditions. Okay, just bring few conditions so that I can guide you. In this condition, these are the spatial tests we can do. Okay, even I'll bring a list of condition of the shoulder and then we can discuss about it. Okay. So tomorrow you all will be free at what time?
Same time.
Same time. Okay, not an issue. So tomorrow just do one thing. Tomorrow you'll just write it down the conditions that we see basically in shoulder. Okay. Everyone will go through the anatomy and the structure and the spatial test, which I have covered right now, the instability and the muscle one that I just taken supra that rotator cuff today and the labral lesion. Okay, these three things you structure wise you have to go through and the spatial test as well. So I'll ask you people to explain it so we know that it's clear for everyone. Because this we will just read it out. It's better we have a discussion over it. Comfortable?
Yes, ma'am. Comfortable.
Okay, then tomorrow just three things you have to read it out. The instability one, the labral and the supraspinatus spatial test. Okay?
Okay, ma'am.
Okay, see you tomorrow.
Thank you, ma'am.